Barbara, first off, when does the county expect to receive the monkeypox vaccines and who would they be available to?
Well, first, we're looking at having a limited supply of vaccine for people who've been exposed to someone with monkeypox or suspected of having monkeypox because they've had an exposure. Those we're going to prioritize. In addition, however, we're working closely with the California Department of Public Health. We've submitted a request for additional vaccine. So we're hopeful in the next 1 to 2 weeks, we will have an additional supply of vaccine to reach out to people. No, there's two types of vaccination. One is post-exposure, which I mentioned for people with an exposure. But we also want to be able to reach out to individuals at increased risk for monkeypox. So that would be pre-exposure vaccination. So the idea is to vaccinate before an exposure. So our plan has been developed. We have strategies in place. We need a vaccine to carry it out.
I know you said limited vaccines will be available. Can you quantify exactly how many and what is the plan for how they will be distributed to those who do need them?
All right, well, I'm saying limited because we wait to see what the state allocates for us. They will determine, California Department of Public Health, how much vaccine we're able to receive. So I can't give you an exact number. I can delineate the plan though for first post-exposure. We have 3 options. One, a person can see their healthcare provider, and if indeed they meet the criteria, they've had an exposure, then we can facilitate getting vaccine to their own healthcare provider within 1 working day so that they can go to their healthcare provider and get the vaccination. Now, it is 2 shots though, an initial vaccination and then a follow-up in 28 days. So plan 1, we facilitate the vaccine to the provider, they do the vaccination. Second option is that we can refer them into one of the Riverside University Health System, Community Health Center. Same thing, we get the vaccine to them and within 1 working day, the person could go in and be vaccinated. And then the third option, if for some reason a person cannot get into either their own healthcare provider or into one of the RUHS community health centers, we actually have a outbreak rapid response team that could go to a person's home, take the vaccine and administer it. So that's post-exposure vaccine.
You mentioned exposure. Yeah. How is someone's exposure to monkeypox reported and can it be self-reported?
First, we expect healthcare providers to report it. They look at the clinical presentation. What's the rash look like? What symptoms do they have? Have they been around someone with a rash consistent with monkeypox? Have they been informed that definitely someone they had close contact with has been diagnosed with monkeypox? So that's part of the assessment. And we just received updated guidance from the California Department of Public Health. So they broadened the criteria for potential exposure. So for instance, there could be a large event, a large pride event, let's just say, where a person's notified that they may have been exposed to someone with monkeypox. Well, we won't have information on whom they were potentially exposed to, but we're now allowed to consider them for post-exposure prophylaxis. So we've notified our providers, we've sent them guidance on testing. So all of that's in place, and we get reports from the healthcare provider. Now you ask, what about the person? So if an individual calls us and says they've been exposed, we do need a little more information, like were they notified, like the recent event in Los Angeles, people were notified of possible exposure. We can use that to say, yes, it appears you could have had an exposure, and we would move forward with looking at facilitating vaccination. So that's all post. For pre-exposure, what we want to do is, and are currently doing, reaching out to healthcare providers who serve people at increased risk, like our men who have sex with men, people with multiple sex partners. So we have identified potential providers that would be interested in having the vaccine so they can vaccinate people before an exposure. So that's our plan. Post-exposure for those that have been exposed, pre-exposure for those where we're trying to prevent them from potentially becoming infected.
You mentioned men who have sex with men. They're still considered the greatest risk for monkeypox infections. You also mentioned Pride. So are you concerned that there could be large-scale events like Pride where monkeypox could be spread among men who have sex with men?
That's a potential, and we do know there's a Pride event coming in November. So again, we're communicating with the healthcare providers who serve our increased population and working on strategies to, one, educate them about the risks and what precautions can be taken.
Obviously, this virus is very different compared to COVID, but what lessons did the county learn from that experience with COVID, and are those being applied in this case with monkeypox?
Well, certainly the communicability between COVID and monkeypox are different. The risk for the general public at large for monkeypox is lower than the risk for COVID, because for COVID, highly contagious, people can have very limited exposure and still become infected. With monkeypox, though, it takes close, intimate contact as one method of transmission, or prolonged close contact face-to-face with someone that may have monkeypox lesions, say, in their mouth. And some people travel to areas where monkeypox transmission is ongoing. So there's differences in how it's transmitted. In terms of lessons learned, though, the importance of educating the public. I mean, we always do that. The importance of contact tracing, meaning looking at who is potentially exposed and reaching out to them. And I think if you think of technology with COVID, one of the things that was implemented was a lot more telehealth visits, right? Using technology to communicate, using technology for interacting with healthcare providers with public health, so people weren't going into a setting and potentially exposing others. I think the other lesson learned is that things are always evolving. So for COVID, right, we had a plan, then we had variants. So for monkeypox, this is a rapidly changing situation. And so we're wanting to stay on top of those changes. The guidance I mentioned, for instance, we just got updated guidance about who would be eligible or considered exposed.
I'm sure you've already heard the criticisms from those who say that the county should have already received the vaccine. So let me ask you point blank, do you believe that the county is behind the 8 ball when it comes to the response for monkeypox?
Not at all. So we have been proactive in getting information. So for instance, we were notified May 20th about what was happening. We had no cases. Right away, we sent out information, a public health advisory to all of our healthcare providers, informing them, here's a problem, here's what we need to do, It talked about reporting to public health, how to report. It talked about what type of testing was needed. It gave information on who was considered at risk. And we've since then ongoing been interacting with the California Department of Public Health, getting updated information, sharing that. We have placed frequently asked questions about monkeypox on our website for the general public, and participating in a variety of forums where we are discussing with the healthcare providers about monkeypox and how to report. In terms of vaccine, we don't determine when we get the vaccine. There's an approval process that involves the California Department of Public Health. They determine the allocation for vaccine. So we've submitted a request hoping to get larger amounts. And as soon as we get it, we're ready to implement one of the 3 strategies that I described already.
At this point, there are no confirmed cases of monkeypox in the county.
We have 1 probable case. That means the preliminary test was positive. And then that sample was sent on to the Centers for Disease Control for confirmatory testing. So I'm waiting for those results. At this point, we consider it probable. We wait for the CDC testing to know if it's a confirmed case or not.
Can you tell us any more about that probable case? Was it in the Coachella Valley?
Well, we're trying to be very careful about the level of details that are provided. We wouldn't want someone to potentially inadvertently be identified. I can say it was in eastern Riverside County, and the individual was not ill enough to require hospitalization and is recovering at home.
Do you think, Barbara, that it's more of a question, not if, but when people start to become infected with monkeypox here in Riverside County?
I think eventually we can anticipate seeing additional cases, again, with how it's spread, that if, we want people taking preventive measures, for instance, being aware if they're having intimate contact with someone, do they have a rash? Are they ill? So that people try and avoid direct exposure if that's possible. We want people to do basic preventive measures, good hand washing. If they're sick, right, stay home, don't interact with others. See their healthcare provider and get evaluated, because those symptoms could be something else. But short of that, right, that education, implementing pre-exposure vaccination, it depends on activities that might increase a person's risk. So could there be additional cases? There could be.
Anything else, Barbara, you would like to say before we let you go?
Well, I think it's important that we continue to communicate with our healthcare providers. We appreciate the media getting the word out, but we feel we're being proactive and trying to ensure we have everything in place to protect our community.
Overall, how concerned are you?
Well, the overall risk of transmission is low. I mentioned the difference between infectivity for COVID versus for monkeypox, and it takes more direct contact. So if we can reach people with education about preventive measures, and when we have sufficient vaccine to do the pre-exposure, that's going to help a lot.
Barbara, we appreciate your time. Thanks for joining us.
You're welcome. Thank you for covering it.